the hospital. This is in the aisle 12 of Walmart. This is on the side of the freeway in a minivan. Okay, this is something that you're going to come upon, and maybe the baby will already be out, and all you have to do is some tidying up, cleaning, and getting her to the hospital. All right, yeah, you don't know where this one's going to be. So when you go to the operating room, or you get to go see a birth in your clinical time, or they even have one in the ER, it's going to be different than what you guys are expected to do in the field. Okay, this is just kind of like a catch, clean, cut the cord business. All right, so BSI, I'm wearing my street gloves. Now, I'm going to call these street gloves for this demo because you do have sterile gloves that you're going to be putting on over your street gloves when the baby's coming out, if you have time. All right, so that's what we'll talk about when I get to that point. All right, in your skills binder, there are the steps for childbirth in there, and you should open up your binder and at least have one set of those steps when you're practicing this skill. You don't have to use this mannequin when you're practicing. You can practice at home with a teddy bear, a string for the umbilical cord, grab some towels, and talk your way through the skill if you do a study group or something like that. Okay, you can pull this off. It's basically very simple. The mannequin, now look how dirty they are. Oh my gosh, you guys, people touch these without their gloves on. This baby is like all oily and filthy, and I'll tell you the components of the mannequin. All right, so you have this baby. He's got a little fontanelle there. You can feel it. That's the soft spot on the baby's head. He's kind of average size. I think he's kind of big. But this, of course, is the plastic umbilical cord. So when you use the cutting tool to cut the cord in your practicing, wherever it went, don't cut this plastic cord and don't even clamp it with the clamps because they lock. So these are cord clamps. You get 2 of them in your kit, but just set them where you want them to go on the cord. And you kind of can lock them in like that if you're going to measure from the baby and pretend, okay? Because once you lock them, I have to find something to unlock them and break them off of that. All right, so the mannequin, this is a cephalic birth that we're going to talk about. I'm sorry I'm spitting. That's a vaginal delivery, okay, you guys? We're not going to talk about C-sections and all that other stuff. There are some complications that you're required to know, like if the feet are coming out first, what would that be? Breech, right? A breech birth is anything presenting except for the head. You could have the baby folded in half and all you see is butt cheeks. And that's going to be really hard for that mom to get through the pelvic bone. Okay, so you might want to consider that's an emergent transport and this baby needs to get to the hospital. I honestly, it's not a complication, but twins are kind of a complication to me because I'm going to have 3 patients. So when you get additional resources, you may be calling for additional ambulance because you have 2 babies to take care of and a mom. Okay, so think about that kind of, in a way, that's a complication. Okay, when you load the baby into the mannequin, it goes head down, head first towards the pelvis, towards the vaginal opening. All these snaps on the ones in the classroom are probably broken off. Most of them are. It's really hard to push the baby through this vaginal opening here, and it's caused a lot of tearing of the plastic mannequin. So just snap it away when you get to that point. I know, I wish we had snap away perineums, right? Easy to take care of, right? But we don't. But in this situation, yeah, just be careful with the mannequins, and you might have to snap it away to push it out. One of you guys should be like guiding the baby through and pushing while the other one's doing the steps of catching the baby and whatever. At least 2 to 3 of you on a mannequin. Okay, that'll work really well. Somebody can be checking the sheet to see that you're following the steps correctly. Somebody else is pushing the baby through, and then the person that's getting signed off on the yellow can be doing the catching. Okay, is that cool? All right, so the way I loaded it, if you guys can see, you can see the spine in here. You can really even see, this is the pelvic bone and the pelvic opening. Okay, so you can see where the baby can get hung up, like if the feet were coming out first and his arm would be caught inside. You may have dislocated shoulders and all that kind of stuff could happen with a breech birth. All right, So I'm going to load it up and start with the natural cephalic head first delivery. Okay, your mom is going to have to have her history taken as well. Okay, so you're going to come on scene, and remember in sample history, you get signs and symptoms, allergies, meds, past medical history, last oral intake, and well, we know what caused this, right? So that'll be the thing. Are you going to write them up there, Mr. Duncan? Oh, well, you're required to ask her some additional questions that go along with just this birth, this pregnancy. So it comes in an acronym, pledge bow. You guys want to try to write it while I say it? Or you got it? PLEDGE, and then bow, BOW, means the bag of waters. Okay, so when we get to that, I'll talk to you about that. So the first P, let me see if I even remember them. I just went blank. Okay, get the skill sheet out. So pull the rules tab, the skills tab, and try to find the OB one. Just right up there, it'll come to me in a minute. Okay, I'm really hot, sorry. All right, so pledge bow. All right, the next thing I'm going to talk to you guys about is the OB kit. Okay, so when you're on duty, you're going to have a kit that's sealed. Now see, this one's not sealed, so it's not sterile, and it means somebody took something out of it that you might need for this birth. All right, so you have a little list of supplies that should be in here. Some of them have this list of supplies, and some of them even have the APGAR score, which is how you score the baby after it's born. I know a couple of you were asking me about the scoring business. Well, this APGAR score is printed out for you, but you still need to learn it so that you can give the baby a good score when you talk to the hospital about what you're coming in with. This baby did this, blah, blah, blah. You found it?
Yeah.
Okay, so just bring it to me.
Oh, okay.
I just want to see it real quick. I'll remember it in a minute. I didn't know I was doing the demo today, sorry. All right, so in the kit, you should have this, which is a Chuck's pad. It's white side up, boys and puppy pad people. Yay, prenatal people. I'll just leave it. All right, so yeah, this would go under the mom's bottom. If you have 2, 3, 4 of them, that's even better, because that would catch any of the wet that's coming out during this delivery. Okay? Wet stuff. You might be amniotic fluid, it might be mixed with blood, and it's a gush usually. If she hasn't already broke her water at home and the gush is over, then you'll have a small amount of liquid to deal with, but honestly, these Chuck's pads will save your boots, your pants, and whatever. That comes to this, the gown. Okay, so what BSI PPEs do you think you want to wear for childbirth?
Face mask.
Yeah. Face mask. Your goggles for sure. Hazmat suit.
Level 4.
And even maybe, put something over my boots or something like that. But you know what? I get really hot in these gowns. But basically, if you're delivering it on a bed or up, on a higher surface, a lot of them just tie the thing around here because this is where all the wet lands. So if you want to protect your uniform, okay, and your boots and whatnot, so you can tie the gown like that comes in the kit. All right, but that face mask thing, that would be awesome. All right, so now we're gonna put our PPEs on. We've got our street gloves on. Mom's saying she's in labor. You can see her obviously having contractions. She may be timing her contractions. Her husband may be there timing them. You can certainly have your partner time the contractions by putting his hand on the belly, but of course she's going to be going, oh, here comes one, and breathe through it, and then you guys are going to time it, okay, from the beginning of one to the beginning of the next one. That'll give you a good idea if you're going to stay here and have this baby, or you can load up in the ambulance and get to the hospital so it can be born there. All right, everybody get that kind of thing? All right, so the first thing we want to know is if she's had prenatal care. So we're going to just ask her, ma'am, do you see a doctor for this pregnancy? Oh, yes, I do. I see her every week now because I'm that far along. That's good. You're going to document that. All right. When was your last menstrual cycle? The reason that's important is if she doesn't have prenatal care, you need to know when her last period was so you can kind of do the math in your brain. And 40 weeks is a gestation period for a human being. 40 weeks, it's not 9 months like we always think. So if she's 34, 35 weeks along, we'll probably be able to deliver this baby, and we're going to have a good, viable baby.
You said what?
In the
36?
field. So 34 weeks. You can normally the lungs are developed a little bit by then, and you're not going to have too much. You might have a small baby, small birth weight at that early, but honestly, it can be born. And if you support it and ventilate and warm it and get it to the hospital, most of those, they're not typically preemies, they're just early. Okay, preemie 1 to 2 pound babies that can fit in your hand, that's scary. Okay, so if she's delivered that and it's breathing, you guys need to call ALS or get some support and wrap that baby up, and that's going to be a really scary call when you have a baby that little. But 4 pounds to 10 pounds, you're dialed, right? We're good to go. Okay, expected complications, I talked about some of them. It's up to you guys to look them up, okay? I can't talk about every complication, but the big ones are the breech. Another big one is if the cord is coming out first and the baby's head is pressing on it. So imagine that. You see the cord and the baby's in the canal and it's pressing on the cord. You should be able to see the cord pulsating. It should pulsate like a heartbeat, and it's really fast because the baby's heart rate's what, over?
It's 50 to 60.
No, that's the breathing rate. The heart rate should be 140, 160, where you can't even count it. And that baby's heart's beating really fast. Yes, when he starts to cry, that way, that's going to be your 30 to 40 breaths a minute or whatever. So you'll see that as well once they start crying. But honestly, this is the only time an EMT or anyone in the field can put their gloved hand into a woman's vagina is to go in there and hold the baby's head with 2 fingers, make an airway, and make sure that cord is pulsating. And I've actually done this in my life. One time, I had to ride in on the gurney. Can you imagine? I'm like on the gurney holding on, and my hand's in here, and I'm watching the cord pulsate. And everybody in the ER, as we're going through to the delivery room, is like, what is she doing? But we had her kind of covered up, and I asked, my name's Terry. Nice to meet you. I have to do this so your baby lives, but we'll talk later, right? Because I couldn't move then. Once I'm there, you're committed. Okay? You need to call for additional resources or get someone to ride with you to take the mom's vitals and take care of all the other stuff, because if you're doing that, you're busy. Okay, everybody got it? Okay. The cord around the neck is another thing. It's called the nuchal cord. And if your baby's head is delivered and you see the cord around the neck, you're going to really try hard to get that cord off the neck, so when he takes his first breath, or he tries to, that he's not going to suffocate and strangle. Or you're going to cut it, you're going to clamp it in 2 spots and cut it right then, because that can really choke him out. And you want to make sure your baby can take its first breath and breathe when it's on the way out. Normally it's probably okay